HSE, hear us clear. We don't want your cutbacks here. HSE, hear us clear. We don't want your cutbacks here. HSE, hear us clear. We don't want your cutbacks here. HSE, hear us clear. We don't want your cutbacks here.
My name is John Hancock, so I'm here at the HSE headquarters at Dr. Steevens Hospital at Houston Station. My reason for being in Dublin today is to fight against these cuts for the home care people. I said not only for myself, I lost an hour, and that hour on me has a dramatic effect, but I know people in much worse situations than I who are incapable of coming here and demonstrating. Now, I'm lucky that I could get here, but I can tell you we'll fight for this till the bitter end, because unless we do, this government and the people that they pass the buck to will walk all over the most vulnerable people. For example, the disabled, the infirm, the elderly. They picked on us this time, I believe, I'd probably be contradicted by them, was because they thought we wouldn't fight back. Well, there are some of us that are fit enough to fight back and will do. And as you can see, I'm double amputee, who's visually impaired, along with all the other illnesses I have. And I rely on the home help coming in the morning to make sure that I'm up and that I've taken my medications. Because I have to take them because I'm on anti-rejection tablets because I've had a kidney transplant. And I have to take them at 10 in the morning and 10 at night. And if I don't know what the effects would be. Because I do it fairly regular. I'd nearly be not sleeping if I thought somebody wasn't coming in. And that does happen. I already said publicly that I feel so strong in this issue, and in last resort I would even go as far as 100.
Hi, Patrick Litch.
Patrick?
Yeah. Hi.
So we're here today, it's with Home Help Home Care Community Action Group. We've been up and running for several months now.
Yeah.
And for the last 2 months in particular, we've been collecting petitions, which is pretty much demanding that Fine Gael and Labour and the HSE reverse immediately the cuts implemented this year. So that will be the 500,000 hours cut at the beginning of the year and the 450,000 hours that are currently being cut as we speak, that were announced at the end of August. So there are 10,000 signatures here, and there are many more right across the country, many home care workers collecting them as we speak. And we are here today to get a response from the HSE because over the last 2 to 3 months, as this issue has gained momentum and a national spotlight, government minister after government minister keeps passing the buck to yourselves in the HSE. So we'd like an official response for a saving of 8 million to cut a further 450,000 hours. It's just not, it's intolerable, it's not acceptable for such a small saving to inflict such hardship and misery upon people who are so dependent upon that minimum support of state support that they do currently receive. To actually take that away from them cannot be justified in any way, shape or form. So that's what that petition here today represents. It represents not just the clients, their families and home care workers, but the people in the communities that they live, in which they live, who are horrified at these cuts. Pretty much they're disgusted at these cuts. So, you know, I'm going to pass you over to John here, who's going to say a few words.
Now, our main concern is that these cuts are having a devastating effect on people who badly need them. And your form of assessment leaves a lot to be desired. When I was assessed, the person who came, I met them once before. They come in all sunshine and light. Now, I'm a person that's always in good form and never do the burrow mouth thing. Now, as far as I was concerned, because of all the illnesses I have, that there was no way. She just said it was an assessment, not that it was an assessment with a view to cutting or increasing. She didn't say either. And I know people that have been assessed and didn't realise what was happening at the time. And so therefore, your people who are doing assessments need to be absolutely trained and make sure that the person who's been assessed has somebody with them who understands what's going on. Because so many of these people are not capable of looking after themselves. Now, is the Minister going to wait until somebody dies as a consequence, like the Galway situation, and then say we need to do something? Prevent that now. I've been on record as saying, as an absolute last resort on this issue, and I'm not trying to go just myself, for other people around the country that are more vulnerable than I, that I will go on a hunger strike. Now, I'm insulin dependent, transplantee, blind, double amputee, and I feel that strong about it. I know I've upset my family by saying this, but that's how I feel. I'm 65 years of age. I am lucky in lots of ways. I'm able to continue having a reasonably good life, but I depend on my home helps in lots of ways. That's Joe Duffy ringing as soon as you get a response. But no, I'm lucky in so many ways that I had home help every morning, which means that whether I sleep badly and I sleep through and they come in at the same time, I woke up in time to take needles and medications, which keep me alive in effect. And with the cut, it means that if I can't sleep on a Wednesday night, I could sleep through till midday or later on a Thursday. I'm meant to take medications and needles at 10 a.m. and that doesn't happen, or won't happen, because how do you? You could be in a semi-coma at that stage, being diabetic. And you just have to take on board about the assessment, and definitely they have to have first of all, stop and reverse the ones you've already done. Because this, you have Eamon Gilmore getting extra aids at a cost of God knows what, Varadkar trying to get a man in at 400,000 when the capping is 250,000. That would have paid for 2,500 carers for the year. I mean, come on, abuse where?
Okay. Yeah. Look, I think all we can do for today is take the petition, and we'll certainly hand it into the CEO's office, and we'll give that. We're happy to listen to you today.
Is Tony O'Brien here today?
Pass it on. I'm not sure if the CEO is in the building at the moment, but we just came down just to take the petition from you. We appreciate that you come here today to have somebody receive that.
HSE, hear us clear. We don't want your cutbacks here. HSE, hear us clear.